Hello guys, welcome back to my channel. Watch until the end of the video and do like, share and subscribe. Severe acute respiratory syndrome coronavirus 2 or SARS-CoV-2 is a viral infection that causes COVID-19. Symptoms can affect the airways and lungs, although this may vary from person to person. About 80% of coronavirus cases are mild. Unless you have severe symptoms, you can most likely treat and cure them at home. But about 20% of cases become either severe or critical and they need inpatient care due to pneumonia and other severe consequences caused by this virus. The three most common classic symptoms of COVID-19 include fever, dry cough, and shortness of breath. Now let's know about the day-by-day symptoms of COVID. Day 1 and 2. Symptoms start off mild. Patient may experience only mild sore throat. On day 3, patient throat feels more painful than the previous day and the body temperature starts rising. Some people may have nausea, vomiting and diarrhea. On day 4, throat pain gets more severe and the patient starts feeling symptoms like tired, muscle and joint pain and the body temperature rises high. On day 5 and 6, dry cough, dyspnea or shortness of breath seems to be appear and the body temperature remains high. On days 7 to 9, patient may have severe dry cough, shortness of breath, headache and the body temperature rises to 39 degrees Celsius. On day 8 and 9, the symptoms get worse at this stage and have fast breathing. On day 10 and 11, if patient have worsening symptom, this is the time in the disease progression where they are likely to be admitted to the hospital or ICU. This patient probably have more abdominal pain and loss of appetite than patient with milder cases. On day 12 to 14, for majority of patient, body temperature and breathing difficulties get back to normal and the dry cough persists for some days. On days 17 to 22, on average, people either recovered from the virus and were discharged from the hospital or passed away after 2 to 3 weeks. When the patients get recovered and discharged from the hospital, it doesn't mean the symptoms are completely gone. Some COVID patients report having symptoms for more than 100 days, including chest pain, shortness of breath, nausea, heart palpitation, and loss of taste and smell. People infected with COVID-19 can still infect others after they recovered, so avoid close contact with the patient for at least 2 weeks until the symptoms are completely gone. A study found that fever among recovered patients typically lasted around 12 days, while cough lasted for 16 days. Shortness of breath lasted even longer, around 19 days. These symptoms generally do not arrive right after a person has been infected. The average incubation period is about 5 days, but it can range from 2 to 14 days. About 50% of people tested positive had no symptoms. That means these people are asymptomatic. That's all for today's topic. Thank you for watching. Hope you guys like this video and see you all in next video.